bringing them into a world where they're unwanted. And it's also just a complicated issue, and it's something that should only be decided by a woman and her doctor. And that's certainly something that I will definitely fight for as long as I live.
Thank you so much, John. Good to have you here.
Thank you.
And Grace Reardon is joining us today from Unrestricted, Minnesota. She's the Advocacy and Engagement Manager for the Unrestricted Minnesota campaign, which is a campaign that works to protect, expand, and destigmatize access to abortion care and all reproductive health care in Minnesota through public education, advocacy, and legal channels. Is there anything you want to add to that, Grace, that introduction?
I think that was pretty good. Yeah. Hi, everyone. My name's Grace.
Awesome. Thank you so much for being here. So we jumped into our introductions without lighting our chalice. We were waiting for people to kind of roll in. I wanted to make sure everybody was present for that. So if you do have a candle or a chalice handy, I have a short reading just to create some sacred space for us here this evening. To be a Unitarian Universalist means we'll never be done with the work of telling the truth about oppression, the work of resisting any laws, policies, or practices that deny anyone their humanity, the work of stubbornly seeking out the spark of the divine in each other, no matter what. To be a Unitarian Universalist means we're not alone in the work. We are not alone because of our promises to love one another. We are not alone because we are companions on the journey. We grow ourselves into allies, helping one another get free. Because none of us is truly free until we are all free. And I actually wanted to start, before we kind of dive into the meaty stuff, I wanted to start by sharing a very quick 2 or 3 minute video that kind of introduces the framework of reproductive justice that I think will be just helpful, so we have some common language and understanding of what we mean when we talk about reproductive justice as a concept. So here, without further ado, is a short video for y'all.
For years, the experiences of Black women, trans people, and non-binary people have been excluded in the fight for reproductive rights. The mainstream pro-choice movement has failed to address that there is no choice where there is no access. By focusing on abortion rights alone, advocacy ignores the barriers marginalized folks face when trying to access things like safe abortions, contraception, and sex education. In 1994, a group of Black women coined the term reproductive justice when they noticed there was little mention of health services like pre- and postnatal care, fibroid screenings, or STI testing in healthcare reform, and little understanding of how things like income, housing, and the criminal justice system affect Black women's reproductive choices. They recognized that the women's rights movement, dominated and led by middle-class, wealthy white women, could not represent the needs of women of color and other marginalized people, and called for an intersectional approach to reproductive health care. The argument that abortion is an individual decision flattens the problem into a binary, pro-choice versus pro-life. Intersectionality reveals how multiple systems of oppression work together and limit access to reproductive options for Black women and other marginalized groups. Since our arrival in the United States, Black women have been targets of reproductive oppression. From being worked and bred like animals to being forcibly tested on like lab mice, our bodies have been controlled inhumanly for centuries. In the 1900s, a new strain of racism emerged called eugenics, a pseudoscience devoted to proving white racial superiority, which led to the forced sterilization of many women of color. Between 1970 and 1980, sterilization cases rose from 200,000 to 700,000. Teaching hospitals across the South routinely performed unnecessary hysterectomies on poor Black women. In 1973, Minnie Lee and Mary Alice Ralph were just 12 and 14 years old when they were sterilized without consent under a federally funded program. As you can see, Black women's reproduction has historically been viewed as negative. To this day, Black maternal mortality rates are the highest of any racial or ethnic group in the country, with many Black women reporting being dismissed when complaining about extreme pain. The effects of these types of injustices are felt for generations. And with bans like the Hyde Amendment and the Family Cap directly impacting people already facing systemic barriers to care, they continue to be ignored. The current conversation is focused on the stripping of rights afforded under Roe v. Wade. But for many Black and poor people around the country, these rights have never been actualized. Black women-led reproductive justice organizations like Sister Song, Ancient Song Doula Services, Black Women's Health Imperative, and others have been fighting to keep women of color and trans and non-binary people's voices at the forefront of the movement. It's time we shift the conversation to what needs to change and address the social, political, and economic inequalities impacting a woman's ability to access reproductive health care. It's not enough for abortion to remain legal. In order to truly have reproductive justice, we need to address all the issues involved. To learn more and take action, visit liberatedbodies.org.
So that may have been review for some of you, or for some of you that might have been a newer framework. And I wanted to highlight specifically the, hang on one second here. The four tenets that we talk about when we talk about reproductive justice, because I think they really help to reveal the intersectionality of this issue, that it goes so far beyond choice and beyond just abortion. So those tenets are, number one, the right to have children. Number two, the right not to have children. Number three, the right to raise the children we have in safe and healthy communities. And number four, the right to bodily autonomy. So those are kind of the core principles of reproductive justice. And you can see how that kind of cracks open all kinds of justice issues, making the issue very complicated, very intersectional, and necessitating approaching access to reproductive care from a whole lot of different angles. So luckily we have Grace here to help us unpack all of that. And she's at the forefront of sort of what's going on legislatively and in this post-Roe universe that we find ourselves in. So Grace, if you would just talk a little bit about the work and mission of Unrestricted Minnesota.
Yeah, and I also want to acknowledge that, you know, there's some people with some expertise in the room too. So like, if you have anything to add, like please jump in. I have been doing this work for a few years, but there's just, especially if you're talking about like reproductive justice as a whole, there's just so much to like learn and know and all that. So, but yes, I will tell you a little bit about Unrestricted Minnesota. Unrestricted Minnesota started out around to kind of create public awareness around the abortion restrictions that were in the state at the time. Kind of culminated around a lawsuit, which, so Unrestricted Minnesota's institutional home is Gender Justice. The Gender Justice brought on behalf of doctor, nurse, Our Justice, which is the state's largest abortion fund and practical support resource, and formerly used to be called something else, but now I'm not remembering the name, and then as well as the First Unitarian Society of Minneapolis. And so that goal was to get rid of all of the abortion restrictions. So that's a 24-hour waiting period, a mandated script, cremation and burial of fetal remains. There was a few others that just made it hard. Oh, a big one was nurse practitioners and midwives not being able to, or nurse practitioners and PAs not being able to prescribe abortion medication, even though like that is within their scope in a lot of other areas. And so one way that we did that was forming a big coalition around this public education campaign. So faith groups, organizers, abortion clinics, family planning clinics. That coalition now is about 30 groups that all kind of have different angles to their work, but all wanted to rally around expanding abortion access. So in July of last year, that lawsuit was successful. And then like 2 weeks after Roe fell, which was like a very weird experience, having abortion access like stripped away throughout the country while having this big win for Minnesota, but was very cool. And then last legislative session, we were able to take a lot of those laws off the books. But now Unrestricted Minnesota is really focused on making abortion access actually accessible to people. So with those restrictions away, you know, people still have financial barriers and there's still a lot of stigma around abortion care. And also we have not achieved that vision of creating a world where people can choose to be like not all people have the ability to choose to be the parents that they want to be with the financial resources, the community support, or the safety and community that that would make that a reality. Yeah, that's a little bit about Unrestricted.
Yeah, that's helpful. I mean, I know that Minnesota has had so many legislative wins in this area. Are there still barriers or restrictions in our state that we should be looking at or addressing? And we're also a safe haven for many other states, but I just am curious if there's like areas for improvement here.
Yeah, so last session, we were able to take off of the books the 24-hour waiting period, the mandated script that like had false information about abortion and stigmatizing information, sorry, it's really 7 p.m. brain in my head.
No worries. I'm with you.
As a few of those others, a couple that were not taken off the books, but were enjoined by the lawsuit, so aren't currently being enacted, are the required cremation and burial of fetal remains, as well as 2-parent notification for minors seeking abortion. And that was one that people really struggle with and legislators really struggled with, which is the reason it wasn't taken off the books. Because I think people get really nervous around minors accessing any reproductive health care. And I think the parents in the legislature felt like, oh, like, well, I would, or parents in the community really feel like, oh, well, I would want my child to come and talk to me and be able to help guide them through that. And that's just not the reality for all kids in Minnesota. They don't all have a trusted parent. They maybe have a trusted adult that they could talk to about their decision to have an abortion. But this law really forced kids to either, you know, if one parent wasn't in their life, like track that parent down, or if they like couldn't find that parent, would force minors to go through this process called judicial bypass, which is where you have to go and stand in front of a judge and they ask you a ton of questions, very invasive questions about your sexual history, about what type of contraceptive you used, what your extracurriculars are at school, like what your grades are, to like demonstrate that you're mature enough to have an abortion. Which is just a very invasive process and ultimately delays care, which is very time sensitive. You know, a few days can push you past the ability to have a medication abortion if that's what you want. So that one stayed on the books.
So just
also, but oh yeah, go ahead.
Sorry, Grace, just to clarify. So in Minnesota right now, parental consent is still required for minors or it isn't?
No, that law was enjoined by the
Okay.
lawsuit. I guess I should clarify, the cremation and burial of fetal remains was not enjoined by the lawsuit for some like complicated reasons. The judge didn't realize that we weren't dropping that part of the case, and so didn't rule on it. But the 2-parent notification was not was enjoined and is not currently
Oh, it is. Okay.
being practiced by most
Okay.
physicians. Yeah. That one probably won't get taken off the books this year, just because the legislature, it was really a hard point last year, and there's only a 1 vote majority in the Senate, and then not quite as close in the House, but yeah, that one was still tricky. And then I'll add our big focus for next year, probably, assuming that like, you know, the legislation moves through its process, is to have a private insurance mandate to cover abortion care. So right now, Minnesota Care and medical assistance cover abortion care in Minnesota. So people who are on public health insurance have access to it, but people who are on through their employer's health insurance or have a plan through MUUSJA do not have abortion care coverage.
Okay.
So and you know, it's interesting when we like talk about this, because it's like abortion compared to so much other healthcare is like not actually that expensive, especially for like a surgery or for like, you know, but
Yeah.
since it's so time sensitive, that still might be $400, $500 that people just like don't have in the moment. I'll say just one other piece of legislation that's like pretty important to increasing access is an increase in the reimbursement rate for Medicare. So right now, clinics are not getting the full cost of abortion back from the state, which it makes having a clinic, like sustaining a clinic, really, really, really hard. So in Minnesota, there's only 8, we might be up to 9 clinics that provide abortion care, and about half of those only do medication abortion. So if you're looking to have like in-clinic procedural abortion, there's very few places to go. And the majority of those places are in the Twin Cities. So people in like further around the state, that's a pretty significant barrier to that care. Now that some of the restrictions are gone, we are seeing some of the bigger hospital systems provide abortion care, but it's more expensive, and like there's still so much stigma that it's hard to get a referral for the hospitals.
That's really interesting, because it completely highlights the point of that video, which was, right, like, even if we have the choice here, or even if, you know, we don't necessarily have the access. And that's highly problematic.
Yeah, and the abortion funds have seen a huge increase in asks for practical support and for covering the abortion costs, both from people in Minnesota and from people traveling to Minnesota from other states. Because like you mentioned, another bill that was passed last year was aimed to make Minnesota a like safe haven state for people accessing abortion care. And a lot of what that bill like does is really about like sharing of medical records and protecting providers from out of state lawsuits, like the ones that like the laws in like Texas say that people, because it's kind of like vigilante laws.
Sure. What are your thoughts about how faith-based organizations can best advocate for reproductive justice?
Yeah, I think a few things. One thing is to, you know, think about how you can be in touch with your representatives about why abortion access is important to you and why reproductive justice is important to you. And I think it can be really powerful to speak from from like the perspective of your faith. So like, you know, I know for many people, like they don't like believe in abortion access despite their faith, but like because of it, and their faith informs those beliefs. So I think it's important to like show decision makers that like there are people of faith who are like very passionate about this issue. So that's one thing.
Yeah, that was a big focus of that sacred curriculum, which was sort of had the point of like reclaiming religious language around abortion, right? Because the right wing has pretty much, you know, taken over that space, and we need to reclaim it from, you know, progressive faith-based organizations.
Yeah, another really good resource if people want to delve more into some of the it's mostly from a Christian perspective, but really delve into some of the like faith arguments for abortion care. Soul Force is a really cool organization and has like a ton of information. I'm going to put it in the chat. Put their website in the chat.
What's it called?
Soul Force.
Okay. Yeah, I don't know it.
And they're kind of,
we'll get to
oh,
your
sorry,
question.
go ahead.
Then we'll get to Shelley has a question.
Yeah, they're like mission as an organization is to combat white Christian nationalism more broadly.
Cool.
So some of their resources talk about other issue areas, but and they're based in the global south, so they do work primarily in the southern United States and then in Central and South America, but they've got some really good resources. Yeah, Shelley.
Thank you.
I just have a quick question. I don't know if you know this.
Yeah.
I live in Rochester where the Mayo Clinic is, and I know on their website they list medical abortions. Do you have any more knowledge about what they're up to?
I'm not sure what Mayo is up to. That would make sense if they're just prescribing like medication abortion. But yeah, I'm not sure. There's also a Planned Parenthood in Rochester that does medication abortion. But I also don't think that they do in clinic procedural abortion.
You like them there.
Yeah, they do really good work.
Any other questions for Grace at this juncture? So
yeah, I have a few other ways
Yeah.
for people to like,
That's awesome.
you know, especially like coming from like congregations.
Perfect.
I think another thing that a congregation could do that would be really powerful is one area that Unrestricted Gender Justice is really thinking about how we can have an impact is kind of dismantling and figuring out how to replace anti-abortion crisis pregnancy centers, which are faith-based places where there's kind of a range of how much they pretend to be a real healthcare clinic, but some of them like pretend to be a real family planning clinic, or they even go as far as to pretend to be an abortion clinic to try to convince people to not give abortions. And they often will offer a free pregnancy test and an ultrasound, but not actually a medical ultrasound. And often they don't have licensed ultrasound techs doing the licensure is kind of complicated, but they don't have qualified people doing those ultrasounds. And yeah, they ultimately delay care. They often tell people that they have resources that they don't follow through on. So they'll be like, you know, we'll help you get housing, we'll help you like have enough food, like if you decide not to have an abortion. And sometimes they're able to do those things. They do often make people take religious parenting classes to access those resources. And sometimes those resources fall through. So we're hoping to like create the conditions where people are able to get the pregnancy care in their community that is accurate and with real doctors, and also have like the support of you know, everything that they need to have a baby without having to go through shaming, religious messaging, and potentially dangerous messaging. Sometimes they like lie about gestational age. They've missed ectopic pregnancies, which are kind of the worst of the worst. But I think one way that congregations can like help kind of combat this is help, raise resources for people to like parent in the way that they want to. So like, doing diaper banks and doing kind of all of those things that crisis pregnancy centers claim to do, without the shaming, anti-abortion messaging. Yeah, Judy.
Grace, oh, I had a question.
Oh,
How
yeah,
else
John.
could we get the word out? I mean, we've talked about in our group letters to the editor, but what would be maybe some other ways of getting the word out about these crisis pregnancy centers?
Yeah, letters to editor are super powerful, and we at Unrestricted like are happy to help anybody who is thinking about submitting a letter to the editor. That's something that we've like done some of and are always happy to support. I also just think like talking to people in your community or like identifying the crisis pregnancy centers in your community and like just like making sure that people know like what they're actually about can be really powerful. It's hard, and we've thought through like what legislation could potentially regulate them. And it's kind of tricky because they're not having people pay for their services. So that's like one avenue that you can't really like use. And then, because they're not real healthcare providers, they can kind of say whatever they want. And it falls under, freedom of speech. One thing that we might try to do this year, potentially in the future, is they have really bad data privacy practices. So they don't have to follow HIPAA because they're not real medical providers. And so many of them are connected to these like very large international anti-abortion organizations, and funnel all of the data about the clients that they're seeing to these big organizations. So we're trying to like maybe crack down on that a little bit, but yeah, it's hard. It's to like chip away at their impact. Yeah, Judy.
Well, if they have unlicensed people providing care or advice, is that even legal?
Yeah, well, because there are these like a lot of them use these, they're called like keepsake ultrasounds. So like sometimes you can go get these kinds of ultrasounds like at a mall, and they're meant to just be like a nice like memento from your pregnancy, but they like dress and those aren't regulated. But like people, if you're going into one of these places and people are like in scrubs and like asking questions like a nurse would ask, people wouldn't necessarily know what that is. And some people do, like who go to these crisis pregnancy centers, do know what they're about. They just like need that pregnancy test or want that ultrasound, or like need diapers. But it's just it's unfortunate that people have to go to these types of places to sometimes get that care. And if they don't know, that's even more dangerous.
They seem almost predatory, like the signage, that preys on people's vulnerabilities and anxieties, and the signs will say things like, pregnant and scared, like that just breaks my heart. And then they're manipulated into a situation that's potentially unsafe.
Well, and just one of the other deceptive practices that they use is they often advertise abortion pill reversal, which has not been the studies that were started on this, and it's like a big dose of hormones. The studies that were started about this like regimen had to be stopped because too many people were hemorrhaging. So they're advertising this really dangerous procedure, and they're connected with doctors around the country who will write those prescriptions. It's dangerous. And then some of them, and this is not the majority, but there's a couple that are outside of some of the clinics in Minnesota. And what they'll do is they'll have a name that's really, really similar to the abortion clinic to try to get people to walk into their doors instead of the actual clinic. So, you know, they might miss their appointment or also just have to hear like all of this like awful stuff that you might hear from like a protester outside of a clinic.
Right, right. Oh my gosh.
Yeah, Judy.
Well, I'm just wondering if faith communities could, especially if you have a member who's a doctor, or if you can partner with, you know, a fully licensed, registered medical professional, that could be really helpful in planning some kind of action or so I'm just wondering if you think that would make a difference.
Yeah, I mean, I think anything to like get the word out about what's happening, and also like, you know, like in your community what the good like family planning clinics are, or like where like people should actually be going. So I think that would be really powerful. And getting doctors to speak up is
Yeah,
huge too, because they have
for sure.
so much respect in the community.
Judy, do you happen to know of maybe someone that we could contact or get in touch with, especially in our groups?
Well, not off the top of my head, but I know that we have someone in our fellowship who is a social worker at the hospital.
Okay.
And she might be a possible resource for putting us in touch with someone who could serve, you know, as an advisor, if you will.
Yeah, and maybe
I'm
at some point.
I'm just thinking
no, go
about
ahead.
this off the top of my head, and so
Yeah, no, I love it.
I would want to give some thought to how we might want to get, you know, trusted medical advice from people who are, you know, supportive of abortion or supportive of women who want to get abortion. So that's just something that, John, would be a good thing to take to the group, the Wilmer St. Cloud group. And I'll check with our social worker who works the hospital and see if she would have any suggestions.
Thank you.
Also, Judy, I think that we're working right now. If it's okay, I'll maybe connect with you after this, over email or something. We're working on an op-ed right now for the St. Cloud Times around the crisis pregnancy centers in St. Cloud. So I would love to. I don't know. I haven't been part of that project, so I don't know like what all is being said in it. So, but I would love to connect with you about that, or whoever makes sense.
Yeah, well, we don't have the St. Cloud Times anymore, but it's online.
Oh, St. Cloud. Yeah.
I do subscribe to that. And we have something called St. Cloud Live, which would be a good. Did you say that there is a plan to have some kind of coverage in St. Cloud?
Yeah, we're trying to get something placed right now. But I don't know what all is in it, so I can't,
Well, that's okay. I'm just wondering what venue, what that you might be using, what I mean, St. Cloud Live is kind of an online newspaper, but they have a weekly print version. And
yeah, I might be getting the outlet wrong.
Okay.
The news outlet.
Well, if you can let me know about that, I can certainly try to follow up.
Yeah.
And I do press releases for our fellowship, so I'm familiar with the different media outlets. So that would be good to know. If you can follow up with that, that would be good to know.
Yeah, I'm gonna put my email address in the chat.
Okay.
That would be awesome, because you mentioned too that you could help provide support for letters to the editor. And I think for a lot of congregations, that would be a really helpful support to have. So connecting you as a resource for congregations would be really highly valuable.
Yeah, well, and it is just so important that like faith voices are represented. That's something that I really appreciate about Unrestricted is we've tried, you know, sometimes more successful, sometimes less successful to have multiple faith voices. So UU is involved, the National Council of Jewish Women, Minnesota, and Jewish Community Action are involved. And recently, IATA Leads, which is an organization that supports Muslim women running for office, has like joined the coalition. But yes, I'm happy to talk about to anyone who's or any congregation who's interested in submitting an LTA.
Yeah, we have, 26 UU congregations throughout Minnesota and into the Dakotas a little bit. And we stand ready to support you and in actions that you feel would be helpful. So just staying in touch and making sure that we get that information and we can disseminate it and, put out calls to action really pretty quickly.
Yeah, and we can have a sample, like if it's helpful, like produce a sample LTE too. That people can just like work off of. On the North Dakota front, Gender Justice recently started working in North Dakota, and we're co-counsel on the abortion. We're trying to get rid of the abortion ban in North Dakota through suing the state. So that too, connecting with some of your like congregations in North Dakota too could be really valuable. And we're building out like a coalition, unrestricted style coalition there as well.
Yeah. Absolutely. Yeah, that would be really helpful. And we, throughout Minnesota want to support our, friends in the Dakotas in any way that we can help our border states. I think we're all really invested and interested in, expressing solidarity and doing what we can to help and support their, causes there.
Yeah. I saw that you included the video about Just the Pill. This might be a good
that's a good segue.
This might be a good segue. Yeah.
So there, it turns out, in addressing this issue of access, so is Just the Pill a separate organization completely from Gender Justice, or is there some relationship there?
Just the Pill is like a member of the Unrestricted Minnesota Coalition, but yeah, they're separate.
Coalition.
They're separate.
Okay. Separate, but aligned but separate. And they have a mobile abortion care van that goes throughout the state of Minnesota to provide, so it's medication abortion, right? And also medical care. So there's a short video that was just on CBS local news recently, and I wanted to play that with you because I think that this could be a really powerful way for congregations to be involved in the movement. So share screen. Second here.
Minnesota nonprofit is hitting the road for abortion rights, but this is not a campaign. The organization called Just the Pill is a virtual and mobile clinic that's already served thousands of patients. As Jonah Kaplan reports, its doctors and leaders think this could be the model for the future of reproductive health.
Abortion may be legal and available in Minnesota, but that doesn't mean it's accessible to everyone who wants or needs it.
97% of counties in Minnesota don't have a brick and mortar provider.
Dr. Julie Amon is the medical director of Just the Pill, the Minnesota-based startup that was actually founded before the pandemic and before the U.S. Supreme Court rescinded the national right to abortion. Just the Pill offers services both virtually and in person, but the physicians are on the move in a mobile clinic.
Even before Roe fell, we knew it was always a skeleton, right? That it still mattered where you lived, what your income was. We try to get within an hour of patients, right? So we try to group them. We did like a big circle of Minnesota when we were driving. So we really try to get as close as possible.
The mobile clinic is not a mobile operating room, but it does have an exam room and a safe space for women to seek an abortion via medications like mifepristone. So they're all within the first trimester. Just the Pill's one van is currently serving patients in Colorado, but there are 3 more on order, with plans to hit the road again in Minnesota, plus Montana and Wyoming. The current team of 5 includes 2 physicians. As for where these mobile clinics park, Just the Pill relying on community partners like churches, synagogues, and community centers.
We're also looking at where could we have pop-up clinics, right? So is there a storefront that we could rent and do, patients there? We're just looking at how can we're very nimble.
It's also unlikely you'll even know they're on the road. Because of security concerns, the trailers are unmarked and there's no public schedule. Jonah Kaplan, WCCO News.
Just the Pill uses social media and outreach to get the word out. Right now, it is supported by 20 different abortion and support funds. It currently accepts Medicaid for Minnesota patients, and it hopes to accept private insurance soon.
Are there any questions about Just the Pill's model? I know I'm not an expert, but I know a little bit about it if people have questions about that. They didn't focus on this in the video, but they do telehealth medication abortion appointments, which might be in the news pretty soon. There's a Supreme Court. The Supreme Court right now has on its docket to accept or deny cert in a case where two different district courts ruled differently on the FDA approval of mifepristone, which is one of the drugs in medication abortion. And so you might be hearing more about mifepristone and telehealth abortion because part of the FDA approval a few years ago during COVID, they got rid of the REMS requirements, which were these kind of unnecessary extra restrictions on mifepristone, which included it not being able to be mailed. So that really allowed a lot of these telehealth. Just the Pill is one of them. There's a few more telehealth clinics to start really thriving and getting people access to mifepristone. But this is one other thing that Just the Pill does. They do a lot.
I think it's so brilliant and exciting. And to me, it seems like this really could be the future in terms of increasing and broadening access to rural communities. And, as you said, the clinics are primarily in the metro area. And I'm thinking of all the Native communities up here. I'm in Duluth. And I was in touch with Julie, the executive director, to explore the idea of some of our congregation being host sites or places where the van could park, or else host these pop-up clinics that she referenced. So I think that's a really exciting prospect, especially in our more rural communities.
Yeah, I totally agree.
Yeah. Does anyone questions about this mobile clinic? You can visit justthepill.com. As they said, they don't post their schedules for security reasons, but you can get more information about the organization and how to support their efforts. Justthepill.com.
Interesting, just another legislative win last year that kind of relates to this is that so Just the Pill, there were anti-abortion activists who were tracking were trying to track where their mobile clinic was and dox it online, and then municipalities that had Just the Pill visit in their community were trying to pass citywide abortion bans, and the legislature last year said no, you can't do that, which was kind of getting ahead of that was looking like it might have be a problem, and they tried to get ahead of it. We'll see. Hopefully it'll stick. Imagine it will.
Yeah. It's a brilliant concept.
I lost connection with you guys because I was trying to keep you on and then send a note to Kay back at our group.
No worries, John.
I think that would be sorry about that. I think that'd be no problem. That would be a certain program that we could definitely get behind. Just the Pill. Excellent program, and it's very much needed in Minnesota, since it was just pointed out so few places to go have an abortion. This is something much needed.
Yeah.
And then, is there a way for them to have ongoing care? The ones that visit?
Yeah, my wife asked this question. Is there a plate with just the pill? Will they get ongoing care, or will they get access to or information about ongoing care after that, or?
Yeah, so I believe part of, at least with their telehealth care, so I assume it's the same with the clinics, they do a follow-up appointment to like make sure that everyone's okay. And then you also get a lot of information about like when you like if something goes wrong, or like if you're having these symptoms, here's when you need to seek additional care at an ER or at an urgent care. So they provide all of that information as well.
Ask a question.
Yeah.
I'm not part of the group, but I worry about if somebody goes in it and seeks care at an emergency room or whatever, are they going to, because I know what it's like in Texas and Oklahoma, are they going to be able to get care? Like if they start bleeding out or something, are they going to be able to get care? Or are the doctors going to be afraid to treat them?
Yeah, so abortion criminalization is a huge problem. Doctors and healthcare providers are actually the most like if you have a charge related to abortion or miscarriage, because they're basically the same, like they're the same bodily process. The person who reports that to the police is most likely going to be a healthcare provider or a doctor, which in most states they're not mandated reporters. They get scared, and so they especially in places like where they have these really extreme abortion laws. The good thing about mifepristone is that if you take it orally, and misoprostol, if you take it orally, there's actually no way for a doctor to be able to tell that that's why you're expelling a pregnancy. So people can go to the ER, urgent care, and say that they're having a miscarriage. A lot of factors, someone's race, their age, substance abuse history, increases the likelihood that will get questioned. Like if they're coming in for miscarriage management, that will get questioned. So like, people are not completely not like, there's still risk associated with that, especially in states where it's like highly criminalized. But that is kind of one protection, is that like abortion medication is not going to show up on a test. So, I am not a lawyer, like I could not give people legal advice, but if they were worried about abortion criminalization, like, and they had taken mifepristone or misoprostol, the safest bet is to not imply that like you were self-managing your abortion.
Yeah, my thing, even though I'm not a member of the group, I'm a mama bear, and I used to be a nurse. And my thing is, I'm going to admit that I am pro-life, but that being said, the reason why I want to know that information is because I want people to be safe if they're going to be taking these, medications. I don't want them to I don't want them to take it and then not get help. That just terrifies me. So I am a little bit more accepting of the different pills and stuff to do abortion. I used to be like totally no abortions at all, but now I'm kind of opening up. And y'all might want to think about how you can maybe help the people that are concerned, the pro-lifers. Maybe you can help them to understand that y'all are not just these like vigilante people, but that you care and that you're trying to help. And maybe that would kind of help win some of them over. But no, I jumped off the bed when I heard about the vans, because part of me think it's great that they're having access to these pills, but at the same time, the nurse in me like just wants to take care of the women that are taking these pills. So that helped me feel better. I don't want somebody going to the hospital and then not getting care. That pisses me off. It's like,
All
you know,
right.
all right.
Yeah,
right.
well, and it's rare, but like there are some pretty, like you can experience some pretty serious side effects. So I really appreciate you bringing that up, and thank you for sharing a little bit about your
Yeah.
journey. I agree that people who like are for abortion access need to do a better job of talking to people about why, and people who are pro-life. So thank you so much for sharing.
Yeah, and that these bans, I think it's also maybe continue to do more and more research and convince these people. I mean, not convince, but we'll convince them, put their concerns at ease about, you know, the serious side effects. That these women aren't going to just go and have these people hand them pills and then send them out in the world. And I know you said they do follow up, but what if one of these people goes to the ER and then is turned away or not given the care that they need? But the
Right.
fact that you told me that there's no way for them to tell why they're miscarrying, that just, I'm just like totally relieved now. I could go sit back down and get on my phone again. So please make sure that y'all let people know that little bit of information about that the doctors are not going to be able to tell. So that allows the doctor to be in the clear, and he can go ahead and just treat the patient as a patient without worrying about his license or being sued or anything.
Yeah, and I'll just add too, like mifepristone is safer than Tylenol. Like it is, like it's safer than, you know. So it is a pretty, but you're so right. Like there are cases where people need to like seek further care. Yeah,
Thank you
Judy.
so much.
Yeah, in addition to these medical, physical type of side effects or need for care after the abortion,
Yeah.
I think that sometimes there may be a need for mental health care, that sometimes because of all the anti-abortion rhetoric that we hear all the time,
Yeah.
that there are women who feel guilt after having an abortion when they hear this rhetoric, or have second thoughts about, should I have really done that? Maybe I should have put the child up for adoption. You know, there's just, I can't imagine the thoughts that would go through a person's head after, and it could be that most people don't have those follow-up concerns. But for those that do, I would hope there would be mental health follow-up as needed.
Yeah, there's such a huge range of how people react, like after their abortion. You know, some people feel relieved, some people feel very sad. It's also, especially if you're doing, not so much if you're having a procedure, but if you're doing medication abortion, like it does take a pretty big toll on your body. Like you are passing a pregnancy. Like there's a lot of blood. There's like it can be really scary. There's also, you know, people who, you're right, might feel like sad or guilty, or if it was a wanted pregnancy, like that comes with so many emotions too. A lot of people who have abortions, it's for a wanted pregnancy. Also, a lot of people are already parents, so there's often a lot of feelings about having an abortion when you're already a parent. So I do think it's so important that like people have like social support. And I think like stigma really cuts off access to people who like might actually have people in their lives who could do that, but like there's a lot of fear, and some of it very warranted. I mean, you know, people might, you know, fear losing their housing, or you know, if they're, you know, intimate partner violent, like there's a lot that people could risk about from being public. There's some really good, just, you know, if you know anybody who might need this kind of support, I think Our Justice has some resources, as well as We Testify. I don't know if they like really have like individual resources, but I find that to be a really great resource where a lot of people have shared their abortion stories, so people feel less alone in that. But I agree, just in general too, like people should have easier access to mental health care. when they need it. I don't know if that answered your question. I mostly just wanted to say like, yes, yes, yes.
No, that's helpful. Thank you.
Anything else kind of simmering for you that you'd like to share? I did want to link in the chat. There is a quite a good congregational justice guide to reproductive justice action guide. And I'm going to put that in the chat. It's I think it was produced by Uplift and Side with Love. And it's very solid, and it also takes your congregation through a risk assessment, which I know, especially for some of our more rural congregations and fellowships, is a real concern. And so it presents different pathways for engagement based on your risk, your comfort level, right? So there's actions that are high risk, there's actions that are medium risk, and actions that are low risk. And it kind of walks you through that process of making that assessment as a congregation. So that's, I think, really valuable and helpful hands-on guide.
Can I just add something huge that I love about UU, and I think is such an important part of reproductive justice and really like achieving a lot of those goals are this quality, comprehensive sex education. And like, I know UU's OWL program is just like really, really good at that, and really like, you know, starts some like some of those hard conversations really early. So I just like wanted to shout that out and say how much how important that is to like really like making sure that people are in like safe relationships.
Absolutely. Yeah. I support your OWL program, fund your OWL program, make sure your community knows about your OWL program, make your OWL program free, accessible, and keep doing it. You're absolutely right, Grace. It's one of our most, in my opinion, and I am a former religious educator, but nevertheless, I think it is one of our most essential ministries, and such an incredibly powerful program for our youth. So that, I mean, that's a great way to do reproductive justice work. Really, really valuable. I'm also going to link in the chat. Side with Love has a page of resources related to putting together a worship service around the issue of reproductive justice. It's very user-friendly. Lay fellowships can use it effectively. It includes chalice lightings and readings and even links to sermons around reproductive justice. So I think that being very public about our position on abortion and experiencing these resources as a congregation is really powerful, and also goes a long way to help destigmatize this issue, right? We're talking about it here. We're talking about it in church. We're talking about it with our faith community, and, you know, you can have a follow-up discussion, and all those actions help take away the shame and the stigma that are so dangerous. So those are two really, I think, valuable resources. And then I'll just put unrestrictmn.org.
Yeah, so this feels like the time where I shout out. March 7th is going to be our lobby day. So we're inviting people to the Capitol. We'll have like save the date registration information out really soon, but we're inviting people to the Capitol to come talk to your legislator about why you care about reproductive freedom and bodily autonomy and LGBTQ justice. So
what day is this?
That's my big shout out. March 7th.
March 7th.
It's a Thursday.
Okay.
And we'll
I'm a
have all the
school
like,
teacher, but I could take off.
we'll have all the tools and resources that people need to. So.
Oh, that's awesome. Yeah, and Unrestricted has a really great mailing list with current information, ways to get involved. So I encourage you all to subscribe and really you'll be able to stay current on actions and events.
And Katie, I know we're at about a time. This is kind of the wrap up, but I also, Shelley, I know you had said that you wanted to talk about disability and disability justice and reproductive healthcare and the movement. And so I don't want to ignore that. There's like so much to say. I'm sure you know this. There's so much to say just because both. Wait, Katie, I'll let you finish what you're doing.
No, go. I was going to
Okay.
circle back to that as well. So, and yeah, go for it.
Well, the really like awful thing is both the anti-abortion movement and historically the reproductive rights movement have really relied on eugenicist talking points. You know, the anti-abortion movement kind of comes out of like white Christian nationalism and white supremacy, which it inherently is eugenicist, and you know, like this focus on white babies, and making sure there are more white babies to like create this white Christian nation state. So that obviously is not what we're moving towards, or want to be moving towards. And then on the other side, you know, you have like the beginnings of the reproductive rights movement and a lot of the research around reproductive health care and just, you know, incredibly racist, using Black women's bodies, and also like Margaret Sanger, like with Planned Parenthood, really having a eugenicist vision of why abortion is important, and like that like disabled children shouldn't be alive. So I think that like as a movement, we really, I think we do a bad job talking about that and contending with that history. And I think what it does, by us not talking about it, it allows the anti-abortion movement to co-opt the disability rights movement and say like, oh, they don't care about children with Down syndrome, like use whatever example that you want. And I think that's really dangerous. And one way to combat that, I think, is this like reproductive justice framework and really pushing for like, no, like we need disability justice. We need to like lessen the stigma around, and also like provide more resources for people to like raise children with disabilities. So yeah, there's like obviously more to say, but those are just like a couple of the, and do that without kind of these carve outs to abortion in the law, because the law just can't address every individual's like reason or need for abortion care. And so yeah, those are kind of my two thoughts. Is there anything else that you wanted to add or ask about or talk about?
I'll just add that I'm writing a book right now with another minister, UU minister, about disability. And in one of the chapters, we'll touch on eugenics. But in our history, Clarence Skinner was a big supporter of eugenics. And the publishing arm of the faith is Skinner House Books. So this year they are changing their name, which is awesome. So we like that. It's
that's awesome.
Complicated history, but I appreciate your information.
Yeah, and I have some I can find some resources too that I can like pass along to this group that like dig into that more. It's not my area of expertise, but I feel really passionate about it.
Thank you.
Yeah, in a follow-up email, I'll include I have the chat saved, and I'll include the resources we discussed here, and can touch base with Grace to see if we can dig a little deeper on some of these issues that we touched on tonight, since there's not time to hit everything, but these are all really important discussion points. Any other closing thoughts?
Just thank you to Grace for sharing all this information. I feel a little bit overwhelmed, but I did. I did
Same
save
here,
the websites. I did save the websites, and I'll look forward to the email.
Yeah,
Yes.
we'll,
Katie,
you know,
thank you.
one little bit at a time. And Grace, yes.
We covered a lot.
We covered a lot.
very
I
broad
know,
range
we're
of
just
things,
like
yeah.
cruising through.
I was a little, yeah, I'm a little, scattered perhaps.
No, you were
Yeah.
beautiful, and we so appreciate your time and your wisdom and your insights, and also your contact information. Hopefully we won't all start harassing you at once,
Oh,
but
feel free, yeah.
Yeah, and just before you leave, is it unrestrictminnesota.org or is that correct?
Unrestrictmn.org. Yep.
Okay, perfect. All right. Sounds good. Great information tonight. Especially about the mobile.
Yeah. Oh, well,
Just
thank you guys so
awesome.
much. Thank you guys so much for having me. I'll just make one other little pitch. I'm part of a coalition called the Reproductive, I've said reproductive too many times tonight, the Rights, Faith, and Democracy Collaborative, and we're really interested in how to combat white Christian nationalism in all of our communities in Minnesota. So if you're ever looking for like training or resources about how to talk about that, which also can be very tricky, especially to a white Christian audience, feel free to reach out.
Okay.
awesome. Thank you so much. This has been such helpful information, Grace.
Yeah, thank
And-
you so much. It was lovely to meet you all.
Of course, yeah. And thank you to all of you too for your contributions and your ideas and your questions and your curiosity, and honestly for showing up. Because December is nuts and it's dark as heck. And I know how hard it can be to log on. And so your commitment and your presence means a lot. So thank you for being here. I have a short little closing reading just to see us out. And extinguish our flames. So if you have a candle, you can hold it up, and I'll close us out with these words. We Unitarian Universalists, who have long been known to be a bit too much in our heads, have been moving towards a more authentic recognition of our bodies, a more genuine relationship with our bodies and being in our bodies. These bodies without which we can neither have inherent worth nor recognize it in others. These bodies without which we cannot experience the interdependent web of all existence, for it is through our bodies that we are part of the self-same web. Let us pledge ourselves, the whole of ourselves, to the great collective liberation of all bodies. Let us pledge ourselves, the whole of ourselves, to do all that we can to protect against gendered violence against all bodies, known and unknown, near and far, stranger or friend. Let us pledge ourselves to inhabit these bodies, to honor these bodies, to celebrate these bodies, and to defend these bodies. So be it. See to it. Amen. May it be so. Take good care, everybody. Rest well and stay warm.
You as well.
Thank you for being here.